So the first disease we'll cover is viral hemorrhagic septicemia virus. This is responsible for a disease known as viral hemorrhagic septicemia. This is a reportable disease, so if you have suspicions, report it to the CFIA. It's a single-stranded RNA virus belonging to the group Rhabdoviridae. Rabies is another virus that belongs to this family. In regards to the pathogenesis of VHSV, it has a tropism for endothelial cells. By causing widespread endothelial injury, it can produce widespread hemorrhage and edema, resulting in anemia and ischemic necrosis. Chronic infections are associated with neurological disease, which is associated with a lower mortality rate. As for its epidemiology, the virus is transmitted via the direct and indirect route. However, carriers are an important method of transmission. Typically, the farm is negative for the virus, yet outbreaks still manifest. This has led people to believe that there are wildlife reservoirs that transmit the virus to the pen. During an epizootic, the significance of the disease is variable and is largely dependent on the host species and the strain of the virus. Pacific herring are particularly susceptible to this disease, resulting in mass mortality. In terms of species susceptibility, this is predominantly a salmonid disease. However, other species can be affected in both freshwater and marine habitats. In addition to gross observations and histopathology, a diagnosis can be made using ancillary tests, including real-time PCR, viral culture, immunohistochemistry, ELISA, and fluorescent antibody tests. The image on the bottom right is an example of a mass mortality event caused by viral hemorrhagic septicemia virus. Clinical signs associated with VHSV include abnormal behavior. Examples include twirling, gasping, and swimming near the surface. On gross examination, the affected fish have dark skin. This is a classic sign of a fish that is distressed. Fish may also have exophthalmia as a result of retrobulbar edema, widespread edema and ascites, widespread petechial hemorrhage, and pale gills, which is consistent with anemia. In the image on the right, you can see widespread petechial and suffusive hemorrhage over the operculum, resulting from widespread vascular injury. Histologically, you'll see generalized endothelial necrosis with associated hemorrhage, thrombosis, and ischemic necrosis of the affected tissue. This is a histological section of the heart. You'll notice that there is an aggregate of karyorectic debris along the junction between the compact and spongy ventricle. This is consistent with endothelial necrosis, with associated hemorrhage and myocellular degeneration. Within sections of the spleen, there are frequent aggregates of karyorectic debris following the exact pattern of the splenic sinusoids, which goes to show just how specific this virus is in its tropism for endothelial cells. Within sections of the liver, there are patches of sinusoidal hemorrhage resulting from endothelial injury. If you look closely, you'll notice a zonal pattern of hepatocellular degeneration as a result of anemia and tissue hypoxia. Viable tissue is labeled in green. Necrotic tissue is labeled in red. You'll notice that within the necrotic regions, there's cellular dissociation and nuclear pycnosis. On closer examination of the liver, you can see widespread endothelial and hepatocellular necrosis with sinusoidal hemorrhage. Many of the hepatocytes contain eosinophilic globules within their cytoplasm. This is erythrophagocytosis and is evidence of a stagnation of blood flow within the region. Within sections of the kidney, there is interstitial hemorrhage labeled in red, which is a result of vascular injury and is associated with degeneration of the hematopoietic tissue. There is also renal tubular necrosis labeled in green, which is likely the result of tissue hypoxia. Infectious salmon anemia virus is the agent responsible for infectious salmon anemia. This is a reportable disease. ISAV is a single-stranded RNA virus of the family Orthomyxoviridae. The common flu is another virus that belongs to this group. In regards to the pathogenesis, the virus has a tropism for endothelial cells. However, it can also replicate in leukocytes. Endothelial injury is associated with hemorrhage, anemia, and ischemic necrosis. The infection will often run a chronic course. In regards to epidemiology, transmission is either direct or indirect. The salmon louse can serve as a mechanical vector. It's unclear whether or not the virus has a wildlife reservoir. However, epizootics are associated with significant mortality. This is primarily a disease of salmonids in both the freshwater and marine environment. Specific species that are affected include rainbow trout, brown trout, and Atlantic salmon. Ancillary testing is available, including real-time PCR. Within the image to the right, there's a focus of hepatic necrosis. This is the result of ischemic injury following endothelial necrosis and sinusoidal hemorrhage. Clinical signs include abnormal behavior, lethargy, and inappetence. Examples of abnormal behavior include slow swimming, gasping, and swimming near the surface. On gross examination, the affected fish will have ascites and exophthalmia as a result of retrobulbar edema. There's also widespread petechial hemorrhage, pale gills resulting from anemia, and splenic congestion. Histologically, common lesions include multifocal hepatic necrosis, which is the result of ischemic injury following endothelial necrosis and hemorrhage. Within sections of the kidney, there's also interstitial hemorrhage with associated hematopoietic necrosis and renal tubular necrosis. As with the liver, these degenerative changes are the result of ischemic injury following endothelial necrosis. Affected tubules will have tubular casts of cellular debris within their lumina. Within sections of the spleen, there's generalized splenic congestion. The image on the bottom right is an example of renal tubular necrosis with tubular cast formation. Infectious hematopoietic necrosis virus is the agent responsible for the disease infectious hematopoietic necrosis. This is a single-stranded RNA virus of the family Rhabdoviridae, and another example of a reportable disease. As for pathogenesis, it has a tropism for endothelial cells, hematopoietic cells, eosinophilic granular cells, and various epithelial cells. Examples include hepatocytes, renal tubular epithelial cells of the intestinal mucosa, and acinar cells of the exocrine pancreas. As a result, it can cause widespread tissue injury. As for its epidemiology, the virus can spread via direct and indirect transmission. It can also spread via vertical transmission. Some of the infected fish can develop resistance, resulting in persistent shedding. The virus is considered endemic in Pacific salmon, and every so often it can produce epizootics in farmed salmon, resulting in significant mortality. This is primarily a disease of salmonids in both freshwater and marine environments. Young salmon are far more susceptible. Ancillary tests include real-time PCR, viral culture, and the plaque reduction neutralization test. Rhabdoviruses have a characteristic bullet-shaped appearance, as illustrated in the images to the right. Clinical signs associated with IHNV include abnormal behavior and lethargy. Examples of abnormal behavior include periods of frenzied activity. On gross examination, the infected fish have dark skin, with widespread petechial hemorrhage, ascites, and generalized pallor as a result of anemia. The image on the top right is an example of exophthalmia resulting from retrobulbar edema and hemorrhage. The image on the bottom is an example of ascites and widespread petechial hemorrhage. Histologically, the lesions are quite varied and include renal tubular necrosis, hematopoietic necrosis, necrosis of eosinophilic granular cells, endothelial necrosis with associated hemorrhage and thrombosis, necrosis of the exocrine pancreatic tissue, and hepatic necrosis. Necrosis of eosinophilic granular cells is considered pathognomonic for this disease. Within sections of the kidney, there's generalized hematopoietic necrosis and endothelial necrosis with associated sinusoidal hemorrhage. This is highlighted in red. There's also progressive degeneration and necrosis of individual renal tubular epithelial cells with intraluminal accumulations of cellular debris. This is highlighted in green. Within sections of the spleen, there's widespread degeneration and necrosis of endothelial cells. There's also widespread lympholysis throughout the splenic white pulp. Within sections of the liver, there are scattered foci of hepatic necrosis, outlined in red, which are associated with areas of endothelial necrosis, outlined in green. Within sections of the exocrine pancreas, there's multifocal acinar cell necrosis, highlighted in red. This is associated with fat necrosis and histiocytic inflammation, highlighted in green. It is an unfortunate consequence of premature activation of pancreatic enzymes. Within sections of the intestine, there's generalized degeneration and necrosis of eosinophilic granular cells. This is highlighted in red. The specific targeting of eosinophilic granular cells is pathognomonic for this disease. Other lesions include degeneration and necrosis of individual epithelial cells of the intestinal mucosa, which can be seen sloughing into the lumen. This is highlighted in green. Cyprinid Herpesvirus-1 is responsible for the disease known as carp pox. This is a double-stranded DNA virus that belongs to the group Alloherpesviridae. In adults, the virus has a tropism for Malpighian cells. In fry, the virus can also affect renal tubular epithelial cells, hepatocytes, and the epithelial cells of the intestinal mucosa. The disease is characterized by recurring proliferative skin lesions. The disease has a seasonal pattern of occurrence that is associated with colder temperatures. In regards to epidemiology, the virus is transmitted via direct and indirect means. It can also cause persistent infections, with recrudescence during periods of stress. This is why it tends to be more prevalent in the winter. Epizootics, which typically occur in young fish, are associated with significant mortality. The virus can affect various species of cyprinid, including koi and goldfish. Ancillary testing is available, including real-time PCR, viral culture, and serology to detect fish that are persistently infected. Clinical signs typically include lethargy. During an epizootic in a young population, the disease can manifest as sudden death. On gross examination, you may find pale papillomatous lesions on the skin, the mouth, and the fins. In fry, there's often pale mottling throughout the kidney and liver, which represent areas of necrosis. Histologically, there may be widespread hematopoietic necrosis, lymphoid necrosis, leukolysis throughout the intestine, and acinar cell necrosis throughout the exocrine pancreas. The images to the right illustrate the various papillomatous lesions you're likely to find on the skin, the fins, and the mouth. The image on the left is an example of what a normal epidermis would look like in a cyprinid. Notice the pale blue mucus cells and the large pink club cells, also known as alarm cells. The image on the right is an example of epidermal hyperplasia and dysplasia in a fish infected with Cyprinid Herpesvirus-1. Notice the complete loss of club cells and mucus cells. Cyprinid Herpesvirus-2 is the agent responsible for herpes viral hematopoietic necrosis. Cyprinid Herpesvirus-2 is a double-stranded DNA virus, which belongs to the group Alloherpesviridae. The virus has a tropism for a variety of tissue types, including hematopoietic tissue throughout the kidney and spleen, leukocytes throughout the lamina propria of the intestine, and acinar cells of the exocrine pancreas. In regards to epidemiology, the virus is transmitted via direct and indirect means. There have been a number of reported epizootics, which typically occur in naive populations. Susceptible species include Carassius auratus, otherwise known as the common goldfish. Ancillary tests are available, including real-time PCR and viral culture. The image on the right is an example of dropsy in an affected goldfish. Clinical signs associated with Cyprinid Herpesvirus-2 infection include lethargy. On gross examination, common lesions include pale gills as a result of anemia, a pale liver, ascites, and splenomegaly. Histologically, you'll likely see hematopoietic necrosis, lymphoid necrosis, leukolysis throughout the intestine, acinar cell necrosis throughout the exocrine pancreas, and on occasion you may see intranuclear viral inclusions within the affected cells. Within sections of the kidney, there's widespread hematopoietic necrosis with associated sinusoidal congestion. Within sections of the spleen, there's scattered foci of necrosis affecting lymphocytes and macrophages of the splenic white pulp. Within sections of the intestine and exocrine pancreas, you can see patches of acinar cell necrosis with associated fat necrosis. This is highlighted in red. There's also widespread leukolysis throughout the lamina propria of the pyloric ceca. This is highlighted in green. Cyprinid Herpesvirus-3 is responsible for the disease known as koi herpes virus. This is a reportable disease. CYP3 is a double-stranded DNA virus that belongs to the group Alloherpesviridae. The virus has a tropism for epithelial cells of the gills, skin, liver, and kidney. It's commonly associated with secondary bacterial infection as a result of colonization of devitalized tissues. In regards to epidemiology, transmission is either direct or indirect. Related species can serve as carriers. Certain individuals can develop persistent infections, which can result in recrudescence during periods of stress. Epizootics typically result from the introduction of persistently infected individuals into naive populations. This can result in significant mortality. Susceptible species include Cyprinid carpio, also known as the koi. The virus can also infect related cyprinids. Ancillary testing is available, including real-time PCR, viral culture, and serology to detect persistently infected individuals. Clinical signs associated with koi herpes virus infection include abnormal behavior, characterized by erratic swimming and slow swimming at the surface, and gasping. This is a result of gill disease. On gross examination, there's pale brown mottling of the gills with excess mucus production. The spleen and kidneys may be enlarged, the eyes may be sunken, and the fish will look cachectic. Histologically, there's marked lamellar epithelial hyperplasia with associated lamellar fusion. Within affected areas, there's also widespread lamellar epithelial necrosis. Intranuclear viral inclusions are uncommon. However, during the early stages of the disease, they may be noted histologically. The image on the right is an example of severe lamellar epithelial hyperplasia with associated lamellar epithelial necrosis. The brown discoloration is the result of tissue devitalization and secondary bacterial infection. Within sections of the gill, you'll notice there's widespread lamellar epithelial hyperplasia filling the interlamellar space. This is highlighted in red. There's also fusion of the tips of adjacent lamellae in the absence of lamellar epithelial hyperplasia. This is highlighted in green. On closer examination, there is degeneration and necrosis of individual lamellar epithelial cells within the hyperplastic epithelium. In some cases, there is secondary bacterial infection as a consequence of widespread tissue injury. Bacterial-laden macrophages are outlined in red. Keep in mind that the bacterial infection could be a red herring. Always remember to check for an underlying herpes viral infection when you're dealing with koi. Megalocytivirus is responsible for the disease known as Megalocytivirus disease. Related iridoviral diseases include infectious spleen and kidney necrosis virus disease and red seabream iridovirus disease. Megalocytivirus is a double-stranded DNA virus belonging to the group Iridoviridae. The virus has a tropism for hematopoietic tissue and leukocytes. Infection is associated with giant cell formation. These are known as cytomegalic cells. In regards to epidemiology, transmission is either direct or indirect. Outbreaks are associated with elevated mortality. Various species are susceptible to infection in both the freshwater and the marine environment. Ancillary testing is available, including PCR and electron microscopy. The image on the bottom right illustrates the characteristic arrangement of virons, also known as a paracrystalline array. Clinical signs associated with megalocytivirus infection include abnormal behavior, lethargy, increased respiration, and inappetence. Abnormal behaviors may include spinning. On gross examination, the gills are pale. This is the result of anemia. Other lesions include splenomegaly. Histologically, there's an abundance of cytomegalic cells within a variety of tissues. These cells often contain intracytoplasmic viral inclusions. Other lesions include generalized leukolysis. Within sections of the spleen, affected leukocytes contain frequent large basophilic to amphiphilic intracytoplasmic viral inclusions. These are labeled in red. There are also increased numbers of melanomacrophage centers with evidence of phagocytosis of cellular debris. These are labeled in green. This is suggestive of increased cell turnover. Within sections of the brain, there are scattered leukocytes with similar iridoviral inclusion bodies. The nuclei of the infected cells are pycnotic, which is evidence of cellular necrosis. Lymphocystis disease virus is responsible for the condition known as lymphocystis disease. This is a double-stranded DNA virus of the family Iridoviridae. The virus has a tropism for fibroblasts, and infection is associated with hypertrophy of the cell. Infected cells can reach a diameter of 1 millimeter and can be visible with the naked eye. The lesions regress spontaneously. However, as the affected tissues are shed, the virus is released. In regards to epidemiology, transmission is direct and indirect. Fish can also serve as carriers. The virus can infect a variety of species in both the freshwater and the marine environment. Ancillary tests include PCR and viral culture. Clinical signs include unsightly lesions. On gross examination, you'll likely find pale nodules on the skin and fins. These can be single or clustered. Histologically, you'll find large numbers of dermal lymphocysts within the spongy dermis. These cells are characterized by prominent nuclei, basophilic cytoplasm, intracytoplasmic inclusions, and a hyaline capsule. Lymphocysts are often associated with histiocytic inflammation. Within sections of the skin, there is marked hypertrophy of fibroblasts within the spongy dermis. These cells are known as lymphocystis cells, and they're highlighted in red. The lymphocystis cells are separated by fibrovascular tissue and inflammatory infiltrates, highlighted in green. The affected cells have prominent nuclei and large cytoplasmic accumulations of basophilic material, surrounded by a hyaline capsule. Salmon Alphavirus is the agent responsible for pancreas disease. This is a single-stranded RNA virus that belongs to the family Togaviridae. Although the disease isn't reportable, there's routine surveillance and control measures in place to prevent its spread into Canada. The virus has a tropism for a variety of cell types, including cardiac myocytes, specifically those in the compact and spongy ventricle, myocytes of the skeletal muscle, specifically those in the red muscle, and acinar cells of the exocrine pancreas. The disease is associated with heart failure and pancreatic insufficiency, which can result in reduced growth. In regards to epidemiology, transmission is direct or indirect. It's believed that the virus has a wildlife reservoir, however, this is yet to be identified. Epizootics are generally associated with low mortality. Pancreas disease is primarily a disease of salmonids in both the freshwater and the marine environment. Ancillary testing is available, including real-time PCR. The image on the right illustrates how the affected fish have stunted growth as a result of pancreatic insufficiency. Clinical signs associated with pancreas disease include lethargy, inappetence, and runting. On gross examination, there's generalized atrophy of fat. The intestinal contents are yellow and mucoid. The heart is typically pale and mottled. Occasionally, you may see hemopericardium as a result of ventricular rupture. Histologically, there's widespread pancreatitis with acinar cell necrosis and pancreatic atrophy. Within sections of the heart and skeletal muscle, there's widespread myocarditis and myositis with associated myocellular degeneration. The image on the right illustrates how there's a generalized absence of adipose tissue. If you look closely, you can also see the yellow mucoid digesta within the intestinal tract. Within sections of the mesentery, there's marked degeneration, necrosis, and atrophy of the exocrine pancreas. On closer examination, all that remains are the pancreatic ducts, which are highlighted in green. Highlighted in red are small aggregates of cellular debris with mild fat necrosis. Within sections of the ventricle, there's lymphohistiocytic inflammation of the epicardium and myocardium, particularly within the compact layer, and to a lesser degree within the spongy layer. On closer examination, there are inflammatory infiltrates along the junction between the compact and spongy layers of the ventricle. This is highlighted in green. There's also associated myocellular degeneration. highlighted in red. Within sections of the skeletal muscle, there's widespread degeneration and necrosis of the red muscle fibers with associated lymphohistiocytic inflammation. This is highlighted in red. The white muscle, which is labeled in green, is largely unaffected. Piscine myocarditis virus is the agent responsible for cardiomyopathy syndrome. This is a double-stranded RNA virus of the family Totiviridae. As with pancreas disease, this disease is not reportable, however, it is being monitored closely. In regards to pathogenesis, the virus has a tropism for cardiac myocytes, specifically those of the spongy ventricle and the atrium. Infection will often result in heart failure. In regards to epidemiology, transmission is either direct or indirect. However, vertical transmission is also suspected. Epizootics are typically associated with significant mortality. As of yet, the disease has only ever been reported in Atlantic salmon. Ancillary testing includes real-time PCR. The image in the top right is an example of exophthalmos resulting from severe retrobulbar congestion, edema, and hemorrhage associated with heart failure. In the bottom image, there is severe mottling of the liver consistent with hepatic necrosis secondary to heart failure. Cranial to the liver is the heart, and if you look closely, you'll notice the fish has hemopericardium as a result of atrial rupture. Clinical signs include sudden death. On gross examination, there's pale mottling of the heart. The atrium and sinus venosus may be dilated. Atrial rupture is associated with hemopericardium. Other lesions secondary to heart failure include exophthalmia, edema, ascites, and hepatomegaly. Histologically, there's endocarditis and myocarditis with associated myocardial degeneration throughout the atrium and spongy ventricle. Within the liver, there's zonal hepatic necrosis, which is associated with passive congestion. Within the image on the top right, you can see patches of atrial degeneration and rupture. The image on the bottom is an example of hemopericardium. Within sections of the heart, there's widespread lymphohistiocytic inflammation within the spongy layer of the ventricle. This is highlighted in red. The inflammatory process is associated with widespread myocardial degeneration and necrosis. The compact layer of the ventricle, which is highlighted in green, is unaffected. On closer examination, you can see the inflammatory infiltrates, labeled in green, and the degenerate muscle fibers, labeled in red, while the overlying endothelium remains intact, outlined in blue. Among the degenerating cardiac myocytes, there's frequent karyomegaly, highlighted by the arrowheads, and multinucleated giant cells, highlighted by the arrow. This is evidence of myocellular regeneration, which is rather limited in mammals. Infectious pancreatic necrosis virus is responsible for the disease known as infectious pancreatic necrosis. This is a reportable disease. IPNV is a double-stranded RNA virus of the family Hemorrhagic. The virus has a tropism for acinar cells of the exocrine pancreas. It can also infect epithelial cells of the intestinal mucosa. The disease is associated with pancreatic insufficiency, resulting in reduced growth. Typically, the virus targets the fastest-growing fish first. In regards to epidemiology, virus transmission is direct and indirect. The virus can also be transmitted vertically. Epizootics are associated with significant mortality. In regards to species susceptibility, this is primarily a disease of salmonids in the freshwater and marine environment. Young fish are particularly susceptible. Ancillary testing includes PCR. The image on the top right illustrates the variable degree of runting in the affected population. In the bottom image, there's an accumulation of yellow mucoid digesta within the intestine as a result of pancreatic insufficiency. Clinical signs associated with infectious pancreatic necrosis include inappetence, darkened skin, and runting for those that survive. On gross examination, common lesions include ascites and yellow mucoid digesta. Histologically, there's widespread acinar cell necrosis throughout the exocrine pancreas. Within the intestine, you may also find evidence of epithelial necrosis with proteinaceous exudates. The image to the right illustrates the classic darkening of the skin, which is often seen in younger fish affected with the virus. Within sections of the mesentery, there's generalized exocrine pancreatic necrosis. This is a fairly acute process, which is why there's a large accumulation of cellular debris. Within sections of the intestine, there's also evidence of mucosal injury, with small casts of cellular debris in the intestinal lumen.